in my eyes, it's a game changer and is the best defence we have and the best protectant we have. Kei te tino reka reka au, kua tai mai tēnei rongoa āraimate, so I'm very excited about the arrival of this vaccine. No te mea nā tēnā, ka whakahaumaru i a tātou te iwi o Aotearoa, te iwi Maori Role. We've already got a lower determinants of health and we already suffer a greater burden of disease, and so to see something else like COVID, if that was to become rampant about amongst our communities, then I think we would suffer the most, as we have for many years. So to have something that we can bring in that's a positive change for us as Māori, but for Aotearoa as a whole, is extremely exciting. I te ata nei, ka tuku i ngā nehi kiau nei te rongoa āraimate. So I was very fortunate this morning. I received the vaccine and I was extremely excited about that, not only for myself, but more so for my family, to protect them and then the greater community, the people that I serve. So nā tēnā, ka tēnā reka reka au, nā tuku nā nehi ki au, a tērā rongoa āraimate. It's not about us as individuals, it's about everyone. It's about our whānau, our hapu, our iwi, me te nuinga o Aotearoa nei. So we have to have that bigger picture kind of thought about that, and we talk about herd immunity, and through those that can get the vaccine and protect themselves and then their families, and that has a greater overarching effect on the community and Aotearoa as a whole. I encourage everyone to get it because it's seen to be safe, or everyone who can get it, right? There are members of the community that can't because of different medical conditions that they have, and if people are unsure, what's really important is they go and speak to their GPs about that. But from the reading that I've done and what I understand is there are actually very few contraindications to this medication. Nā tēnā, haere koutou ki te whiwhi I tēnei rongoa āraimate. So because of that, there are very few reasons why whānau shouldn't be getting this immunisation. Fortunately, Turuki have been involved in the rollout of the first vaccination here, and I think that's extremely important because it gives Māori a voice. We're doing it in a way that is appropriate and safe for our whānau, our hapu and our iwi, and so I think we as Māori providers have a critical role in ensuring that we're doing this in a way that whānau feel safe and are able to talk about their concerns in an open and honest way, and that we're able to guide them through what the evidence is currently. Ko te mahi o ngā nehi me ngā tākuta Māori, ki te kōrero ki a rātou whānau, ki te whakamōhio I a rātou, kia te painga o te rongoa āraimate. It's our role as Māori providers to have that good, open and honest conversation with whānau and answer the questions, and there will be many questions that they have about the vaccination, and to give them the evidence that's come to light. Ko ngā nehi tuatahi I tuku te rongoa āraimate no Ngāti Porou ahau, nā tēnā, he tino whakahihi ahau. So I'm extremely proud of the mahi that Turuki has done. The two nurses that were involved in the very first vaccination in Aotearoa, they're from Hikurangi Maunga, they're from my iwi, and so I felt extremely proud of those girls and the mahi that they're doing. Ka titiro koe ki tērā wāhi ki Amerika, ka mōhio mātou he nui ngā tāngata I whiwhi tēnei rongoa āraimate, and kei te pai rātou, kei te ora tonu rātou. This medication has been trialled extensively in America and over in the UK. So what we see in looking overseas is that there's very few adverse reactions, in particular anaphylactic reactions to this vaccination. What we're seeing from overseas is that this is a safe medication. that if I feel confident in having it, and the people that are looking after you feel confident in having it, then we wouldn't be recommending anything that we didn't, know that we wouldn't give ourselves and our whānau. So my advice is, ki ngā whānau Māori, haere atu ki o koutou tākuta, o koutou nehi, ki te kōrero, he ho o koutou āwangawanga e pāna ki tēnei rongoa ārai mate. So if you have any concerns, go and speak to your health professionals, go and speak to your doctors and nurses. They are the ones that you should be speaking to, and I think they're the ones that have got the evidence, the training, the facts, as opposed to on Facebook or e rā tu mea poke mate or auntie or uncle, or they're the ones that are receiving the facts and the evidence-based information, not ngā pūrākau, not things that are, as you say, rumour. We want hard evidence for our whānau to know that they're safe.